In March last year, the Provincial Treasury announced a 784 million rand allocation to address a backlog in surgical and radiation oncology services. The Cancer Alliance, represented by Section 27, says that more than a year later, patients are still unclear about their fate. Salome Meyer is from Cancer Alliance and joins me now. Salome, very good afternoon. Appreciate your time. Now, you've just listened to Dalitale Modiba, Head of Communication for Gauteng Health, and he suggests that you are sort of sore losers, that the issue really isn't about failure to spend money, but it's more about, in fact, he alleges that one of your preferred bidders didn't win the bid. Your reaction to that?
Good afternoon to you and to all our listeners, and I can say to you that the allegations of a preferred service provider is completely unfounded. What we are after is that government needs to provide an integrated treatment urgently, no matter how they do it. And we also need to say that the notice of motion specifically says that we're asking the court to mandate them to provide the services within the public or the private sector. So what we do know is that Gauteng Health is now literally trying everything that they can to either delay it or to discredit us, or to delay the matter in court, because they have awarded a tender for 250 million rand for planning services only, when the agreement was particularly that we need an integrated service meaning focusing on the professional services of a radiation oncologist that is required in the treatment of for radiation oncology, planning services, as well as the actual treatment of patients. They went ahead and they awarded a tender for one aspect. We are asking, how are you and when are you going to, in fact, manage the rest of the services that still have to be provided? We're also saying that spending 250 million on one aspect only is irrational. What we further know is now the department goes even further and saying they dispute that there is a backlog list of 3,000 patients. That is after we, in fact, supplied them with such a backlog list.
Now, if they argue that there isn't a backlog of 3,000, what sort of numbers are they putting out?
We don't know what numbers they actually are indicating. The last meeting that we had with them, and I want to say that was in April of last year, they confirmed 2,500 patients on a waiting list. So they're actually going against their own information and their own statements that they are making.
Okay, so when we look at this budget allocation of 784 million rand, is it large enough to take care of all the needs around these cancer patients? And I think the number that you might have indicated is 3,000.
So when we look at the current rates that are basically at the moment applicable within the public sector, so we're looking at what is already available in other provinces in terms of integrated services. We know that a patient can be treated for around, and I want to use a round figure of 95,000 rand per patient for their treatment cycle. The figures
how long is the cycle?
Well, that is dependent on the type of cancer. So it really, and there, I'm sorry, I can't give you exactly that kind of information because I'm not a clinical specialist. But you're talking about you could be 9 fractions or it could be 16 fractions. So it is very much dependent on the type of cancer that has to be treated.
So I suppose what I'm trying to ask, excuse me, Salome, is would 95,000 rand suffice for a year of treatment? As I suppose is my question.
No, it's not a year of treatment. So when we look at radiation treatment, it is a short period of time. So a patient will be called in for a session either once a week over a period of 6 to 8 weeks. And that's it. And that's how many treatments you will receive as a radiation oncology patient. What we do know is that the 250 million rand that was set aside. So if you literally do your sums and you divide 250 million by 3,000, you are going to get 83,000 rand. And that 83,000 rand in 2022 was more than enough to actually manage 3,000 patients. And that figure or that information was provided to the Treasury Department. Based on that information, they allocated the 250 million rand dedicatedly for a backlog list. The remainder of the money, meaning 534 million rand, was to be spent on additional equipment that was required, such as brachytherapy machines, as well as the upgrading of bunkers at Charlotte Mtkeke, etc. So that is what the remainder of the money was meant for, and I should also include for surgical backlogs. And we have got no idea whether any of that money has been spent, and if it has been spent, what it has been spent on.
What you're talking about is the balance of the 215. So let's focus on that 215. How much of it has actually been allocated and spent? And how many patients, if you have an idea, are there any patients that are benefiting from this amount?
So it's 250
Okay.
million. So 250 million was awarded for a tender for planning services only. To date, not one single patient, to our knowledge, has benefited from any of the money that has been allocated.
So what are the implications, Salome, of? I mean, we're going back a year, I think, because when the issue and the alarm was raised by yourselves and others. Just unpack for us what would have happened to the average cancer patient in 1 year of failing to get this treatment, even though 784 million rand had been allocated by Treasury.
There are many patients that have already, in fact, passed away. There are patients that have been informed that they actually would not benefit from any further treatment, and therefore they actually have to wait to enter the last phase of their life. There are, in fact, patients that have been, and we know of one patient in particular, that have been recalled, but called for her radiation oncology treatment. That was 6 months after she was called in for an assessment and indicated that she will get her radiation treatment. So we do know that there's a serious backlog at Charlotte Mtkeke. And that is the reason why we are also calling for the backlog list to be updated, because we suspect that at least 1/3 of patients will still require radiation therapy. At least another third of patients would now be re-diagnosed with either a cancer that has spread and that now has to be treated with systemic therapies, which will cost government at least 250,000 rand per patient, if not more. And then at least 1/3 of patients will no longer benefit from any radiation therapy or would have passed away. What we are saying with that is only when you start revisiting the backlog list, you will know what the true quantum is of patients that still require treatment and what the real actual impact of inaction is for this crisis. And we are suspecting that this could actually even be worse than life esidimeni, where far more patients would have actually died already, but we just don't know about them.
Okay, that's where we'll leave that conversation. Salome, Meyer from Cancer Alliance, appreciate your time speaking to us on the court case brought on by Cancer Alliance around Gauteng Health and how they've failed to spend 784 million rand on oncology services for much needed cancer patients.